Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for Alberta. Dr. Hinshaw will provide a brief update, and then we'll open the floor to questions.
Thank you, Tom, and good afternoon. Today, I am pleased to report 5,979 Albertans have recovered from COVID-19, leaving 762 active cases in the province. Currently, 45 people are hospitalized with COVID-19, with 5 of those admitted to ICUs. In the last 24 hours, out of 3,010 new test results, there were 19 new cases. Sadly, I must report 3 new deaths today. I would like to extend my sympathies to all those who have lost loved ones during this time. These deaths are a reminder of the worst-case scenario outcome from this virus and why we need to continue to take this seriously. One of the ways to do this is through the use of personal protective equipment for those who could be exposed. That's also called PPE. Through the last few months, you have likely heard a lot about PPE. This refers to supplies such as masks, gloves, and gowns. Here in Alberta, we have been working to meet the immediate need for PPE across the province in the context of a global shortage. We have been able to supply our hospitals and our first responders. Additionally, we've been able to help other groups meet their PPE needs, such as some nonprofit community groups and businesses, while their regular supply chains were interrupted. Thanks to the procurement expertise and relationships we've built in Alberta, we've been able to meet the demand despite enormous pressure on global supply chains. Now, as more companies around the world produce PPE, it's easier to get these products on the open market. Businesses and organizations have more options. As Alberta moves forward with our relaunch efforts, the need for PPE to protect vulnerable Albertans remains paramount. This is why the provincial government is keeping key groups as a priority while we change our distribution process. Going forward, we will continue to prioritize PPE for those at highest risk of exposure to COVID-19. The province will continue to ensure publicly funded or contracted settings have PPE at no extra cost. This includes Alberta Health Services and Covenant healthcare workers, first responders, and those working in homeless shelters and publicly funded or contracted seniors' care facilities. For those who do not have other sources in the short term, private organizations can continue to access PPE through the government until June 30th, but will need to pay a fair market price. After June 30th, they will need to get PPE from their own suppliers. I'd like to be clear. Government will continue to support and prioritize Alberta's critical service providers in publicly funded or contracted settings. There will be no changes in the provincial PPE supply for hospitals and clinics operated by Alberta Health Services, continuing care facilities, supportive living facilities, and home care services, which are operated or contracted by Alberta Health Services, publicly funded lodges, mental health housing, residential addiction treatment facilities and shelter operators, and police, fire, and emergency medical services. N95 masks will be provided at a fee to dentists for emergency procedures only, and to morticians for embalming procedures for the duration of global N95 shortages. These requests will be managed through the professional associations. This is a decision the government did not make lightly. It is in line with other jurisdictions across Canada, including Quebec, Ontario, BC, and Manitoba, who are making the same decision about PPE distribution. I'd like to preemptively address any fear that Alberta is running out of PPE. We are not. However, as we continue to move forward with relaunch, it's important to have a long-term plan. That said, this approach will be flexible. If there is an emergency short-term issue, such as a threat to food security, an organization can request PPE through the government, and such requests would be considered on a case-by-case assessment through the Provincial Operations Centre. Finally, this announcement does not change the Premier's promise to distribute non-medical masks to the public. More information on that will be coming soon. Remember, the best way to prevent the spread of COVID-19 is through physical distancing and good hygiene. Stay home if you aren't feeling well, and get tested if you have any symptoms. Businesses and organizations are encouraged to visit Alberta BizConnect for guidelines on how to keep their employees and patrons safe, as well as for information on a range of PPE suppliers. It doesn't matter if you are a business owner, a worker, or a customer. We are all Albertans, and working together, we will continue to move forward safely. Thank you, and I'm happy to take questions.
All right, we'll now go to the phones. In addition to Dr. Hinshaw, we also have Shane Schreiber, Assistant Deputy Minister with the Alberta Emergency Management Agency, available for questions. Operator, could you put the first caller through?
First question is Brenna Rose with CTV News. Go ahead, Brenna.
Hi, Dr. Hinshaw. The owner of Canadian Martial Arts Centre in Lethbridge says that he's going to reopen June 1st without any added safety measures. He says that it's his right to own his own business and that the government is overreacting to COVID-19. What is your reaction to those statements, and what would the message be to his clients who are potentially considering coming back?
So I think that it's challenging when we've seen such success of our public health measures and the low circulation of COVID. And so the fact that we've been able to successfully contain the spread through our measures has the unfortunate side effect of having people perhaps not see how serious the situation is. And so, first of all, with respect to that operator, I would say that I know that this time of closure has been very difficult for many businesses and that it's frustrating to wait for the different stages of relaunch. We do recognize that sports, fitness, and recreation are very important, and we are working on frameworks to be able to facilitate opening of various sports, fitness, and recreation options for Albertans, because we know that that's critical for both physical and mental health. But finally, I would say that we have to remain vigilant. The virus has not gone away. And the fact that we've been so successful is because of these measures that we've taken together. And so if collectively we stop taking these protective measures, then my concern is that the virus can spread and spread through to people who are vulnerable to poor outcomes. And while those who are older and with chronic medical conditions have the highest risk of death, there certainly can be severe outcomes for those even who don't have pre-existing medical conditions. So I think that both this owner and those who are considering perhaps attending sites, whether it's his or others, who are feeling frustrated by the limitations and wishing to go against the public health orders, I would say again, we have to stay in this together, and that the reason we have had a low number of cases is because of what we've done together, and we need to continue to protect those who are most vulnerable in our society and limit the spread.
Operator, can you put through our next question, please?
Next is Michael King with Global News. Go ahead, Michael.
Hi there, Dr. Hinshaw. With relatively unchanged numbers in Edmonton, the North Zone, the Central Zone, and no real spikes in the rest of the province, is it safe to say that Phase 1, now that we're kind of 10, 11 days in, has gone well?
So I'm certainly encouraged by the numbers 10 days into Stage 1 of relaunch. I think that we know that the incubation period is up to 14 days, and we also know that sometimes it can take a little while for businesses to open and for the full impact of relaunch to be seen. So while it's very encouraging, and I would congratulate all Albertans for this early success, I think that we also again need to be mindful that it's not over yet. We will continue to watch for that full incubation period. We'll be watching Calgary and Brooks as the hair salons and restaurants are able to open today, and watching over the next 10 days to see what kind of impact that has. And again, I think that this should be taken by Albertans as a really excellent sign, and a sign of what we can accomplish together when we continue to follow public health measures.
Operator, can you put through the next question, please?
Next is Jeff Slack with 660 News. Go ahead, Jeff.
Hi, Dr. Hinshaw. On Friday, we had just about 865 active cases. Today, we have 762, and also hospitalizations seem to be going down. I was just wondering, does this indicate that we might move forward faster with the Phase 2 of the relaunch?
So we're looking at multiple options for stage 2. The date that has been put out as the earliest possible is June 19th. I think, as I said earlier, it's very encouraging to see that the numbers have remained low despite stage 1. We still do need to watch in the places where we are continuing to have the most cases, so looking at Calgary and Brooks as they ease through their 3-phased approach of stage 1. But I think, again, the most important thing in our relaunch is that it is data-driven. So we'll continue to watch the numbers, and we may be able to consider alternate dates if our numbers remain good. But again, that's really up to all of us together to keep those numbers low. And so I would encourage Albertans to see this as an encouraging sign to continue following public health measures.
Operator, can you put through the next question, please?
Next is Kevin Nimick with CTV Calgary. Go ahead, Kevin.
Hi, Dr. Hinshaw. The province's relaunch document says PPE is necessary when physical distancing of 2 meters can't be maintained. So will mask wearing be enforced in barbershops and salons? And who would face a penalty if someone wasn't wearing a mask? Would that be the customer or the business?
So businesses are, as a part of relaunch, those businesses that are opening are asked to follow the guidelines in the document that's specific to hairstylists and barbers. It does recommend PPE, but the requirement, actually the specific requirement there is for blow drying, actually. If a stylist is using a hair dryer on someone's hair, that does require the PPE to be used by both the stylist and the client. But with respect to legal enforcement, again, I think I would really encourage people to remember that mask wearing is for the protection of others when you're wearing masks when out in public. And so with respect to the stylists and those businesses, I think that the importance is, again, that if those businesses are taking care of their clients and their employees, then they're going to be ensuring that that's a part of their framework for reopening. And I honestly think that part of our relaunch is going to be looking at businesses to be marketing themselves as safe places to go. And so I think there's going to be a competitive advantage to businesses who are able to showcase the measures that they're taking to keep their employees and their customers safe. So again, I really want to make sure that people understand the guidelines that we've put in place are meant to support businesses and support the general public to know how to keep themselves and others safe. And while there are certain measures in there that absolutely will be enforced if needed, such as if there are businesses opening outside of the times when they are allowed to by the order, that there, if necessary, enforcement will take place. But some of the specific pieces of guidelines that are meant to support and encourage owners, that really is up to the discretion of the enforcement operator. So the enforcement officer, as they engage with operators. And so really it's about the reminder of what's needed, what's going to be safe for employees and for clients. And usually there's an opportunity for employers who get those kinds of reminders from our frontline public health officers to voluntarily comply with those reminders. And so it's not necessary to go to enforcement with a single infraction. So again, I don't know that a barber shop where one client isn't wearing a mask would get a fine, but it could be perhaps just a reminder that that person is potentially putting others at risk, and a reminder of the importance of having face coverings for all those who are in those kinds of facilities.
Operator, can you put through the next caller, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. Your Twitter account put out some information about mosquitoes, but I was just wondering if you could expand on that a bit. What should Albertans know about whether or not mosquitoes can transmit COVID-19? What other illnesses should we be mindful of that can be spread through mosquitoes?
So there's no evidence that COVID-19 can be spread through mosquitoes, so that is something that Albertans should not be worried about. Albertans should, however, be thinking as the summer approaches of illnesses like West Nile virus. And so all the typical precautions we would recommend, such as wearing mosquito repellent when outdoors, wearing long pants and long shirts if they're going to be in areas where there are lots of mosquitoes. Those are the kinds of things that would protect Albertans from any kind of mosquito-borne illness. And again, the most common one, other than the irritation of the mosquito bite reaction, but the most common significant illness here is West Nile virus.
Operator, can you put through the next question, please?
Next is Heather Yoricks with Global News. Go ahead, Heather.
Hi, Dr. Hinshaw. The BC Coroner's Service has reported an increase in opioid deaths in that province for the month of April. I'm wondering if we have a sense here in Alberta yet of how the COVID-19 crisis has impacted the opioid situation in our province.
So that's something that I have been working with our epidemiologists to look at. I haven't seen April data, and that's something that we're waiting for because we have observed what BC has reported with great interest, and that's something that we're looking at again carefully here. So again, the April data is not available yet, but we'll be looking for that as soon as it is.
Operator, can you put through the next question, please?
Next is Jacque Wilson with Global News 770. Go ahead, Jacque.
Dr. Hinshaw, this is a three-part question for you. Number one is there's more and more concern from sport organizations, across this province, feeling that Alberta Health has misclassified sport, fitness, and recreation, where other provinces have not classified it in Phase 3. So number one, I would like to know why you have put it in Phase 3 of your relaunch program. Number two is, if sport organizations can provide a health and safety protocol for return, why would you not look at it and maybe move that launch up a little bit? And number three is I understand sport organizations did meet with Alberta Health on Friday to express their concerns. Can you give me an update on that, please?
Sure. So first of all, with respect to the classification, as we were doing our initial relaunch framework, we looked at environments where there would be many people together, where distancing would be difficult, and where there could be the potential for a super spreader event, or where you have one person who's potentially infectious and that might spread to many other people. And so some of the settings where that's been seen to happen are places like indoor fitness classes. So, for example, high-intensity fitness training in a group indoors. There have been reports globally of outbreaks in those settings. And again, with sports, it's more about the kind of the group of people that are getting together and where it's difficult to maintain distancing. Having said that, we have heard concerns and also have been watching the experiences of other jurisdictions who are, so for example, BC and Saskatchewan, who have classified sports and recreation in an earlier phase. And so we are looking to pull together a proposal to bring forward to our Emergency Management Cabinet Committee to have a discussion about reclassifying areas of sports, fitness, and recreation that could be moved sooner potentially, depending if the guidelines are met. And the meeting that you're referencing on Friday was one that was specifically so that we could hear from sports organizations. We do have sports guidelines that are in the works, and we wanted to get sports associations' feedback on those guidelines. We anticipate those guidelines will be posted by the end of this week, because when it comes to outdoor recreation, certainly any sports organization that can have their activities meet those current outdoor recreation guidelines can start that right away. And those who perhaps there might be some challenges meeting the current outdoor recreation guidelines, the sports guidelines that are coming by the end of this week will help give some guidance on how sports can resume safely. We recognize the importance of sports, recreation, and fitness, and so that's something that we're prioritizing both with the guidelines that are coming out this week, as well as the discussion that we intend to have with the Emergency Management Cabinet Committee on a potential reclassification.
All right, I think we've got time for two more. Operator, could you put through the next question, please?
Next is Dylan Short with Post Media. Go ahead, Dylan.
Hi, Dr. Hinshaw. We've heard reports from other provinces about issues with testing and contact tracing. We've heard how well we've been doing at testing and contact tracing for weeks now in terms of numbers and capacity. I was just wondering if we could get an update on how well we're testing now, or are we still at some of those higher capacities, as well as the contact tracing app that was unrolled not too long ago. If we could get an update on that as well.
Sure. Our lab has done amazing work at ensuring that we have the capacity to meet all of our current testing demand. And I can't remember if it was last week or the week before, about our priorities with respect to testing, where we want to make sure that we have capacity to test all Albertans who have any symptoms, including symptoms in our current longer list, which includes things like loss of smell or taste, loss of appetite, nausea, vomiting, diarrhea, muscle aches. So some of the broader symptoms that aren't necessarily the core symptoms of COVID. And our lab is able to meet the full demand for that testing for all those who have symptoms, for all close contacts of confirmed cases, whether or not they have symptoms. We've been doing testing in outbreak settings of all asymptomatic people in that outbreak setting. And our lab has been able to accommodate all of that volume, which again, is very important. Our lab also has been able to create capacity should we have a surge of new cases or an outbreak in a setting with many, many people, and that's really important. So the testing capacity that we have every day is not just to meet our daily demand, it's also to be able to accommodate surges and spikes in demand, and so we have that available. With respect to contact tracers, our teams in Alberta Health Services have been able to recruit additional contact tracers to supplement our core teams, and they have been able to manage the demand even when we had higher than typical case numbers. And certainly now with the current case numbers, our contact tracers are more than able to meet demand in a timely way. And as I mentioned last week, we have had the first use of our AB Trace Together app, which did validate the ability of that app to pick up when there is a close contact with a confirmed case. So I would encourage all Albertans who haven't already done so to download the AB Trace Together app, which can help our contact tracers in making things more efficient.
Operator, can you put through the final question, please?
Final question is Matt Woodman with CTV Edmonton. Go ahead, Matt.
Hi there, Dr. Hinshaw. I'm just curious, if the NHL chose Edmonton as a hub city to host some of the games to finish off the season and award the Stanley Cup, would the province be open to easing restrictions for those players participating so that they can get on the ice, practice, train together ahead of Phase 3 beginning for people who actually live in Alberta?
So if the proposal were accepted, then the NHL would have to follow public health guidance and make sure that all of the recommendations for prevention of disease spread were met. And so that would be something that we would have to talk to the NHL about to make sure that the specific requirements were able to be met. And so that, again, would be something that if that were to happen, we'd have to have that conversation.
Thank you all for coming. We will provide another update on COVID-19 on Wednesday.